Hey, Dr. Lori here, and I just want to answer some questions about how we approach dental cleaning. I've got lots of information on tartar and pH and how tartar in the mouth is really the sign of osteoporosis. The sign that you are hyperventilating and your body is in an acidic pH, which is a disease state. So we like to educate our patients about um, how to take care of the teeth. Most people are deficient in vitamin D3 and K2, which takes the calcium into the tissues, into the bones and teeth where they should be. And so part of our prevention protocol is brushing every day with a liquid D3 K2 um, supplement, and you brush it right into the teeth and gums. And as you take in more D3 K2, you will not have free calcium floating in your blood, which actually reduces allergic reactions, even anaphylactic reactions. And so we also have people use iodine. Most everybody I see is iodine deficient, and every cell in your body needs iodine. Every cell in your body needs D3. And so as we have people brush with the iodine also into the gums, teeth, roots, all around the teeth, as we have people do that, first off, their sensitivity goes away. It helps to arrest decay. Teeth can be self-healing. And decay really is a head hormone problem. The hypothalamus, pituitary, parotid, thyroid, and parathyroid all have to be out of sync to have decay, because as your commode flushes out, that's the right way. Well, teeth are supposed to flush out acid and minerals in order to heal whatever damaged cells are there. But when those head hormones are off, then instead of the teeth flushing out acid and minerals, they begin to take in the centripetal. I've forgotten most of the physics I ever knew, but centripetal flushes out or makes a circle and sprinkles out. And centrifugal, I believe I've got it right, is that fluid flow is reversed, and the teeth take in bacteria and food particles that are in the mouth, and that's how you get decay. So we want that dental fluid flow to be correct and going out to flush out the healing acid and minerals to repair. Teeth can repair. It's called arrested decay. It is alarming because most of the time it's black when they're healed, which is alarming, but that's actually evidence that the teeth have healed or the tooth has healed. And so we want the teeth to be self-cleaning, and that is has everything to do with how you breathe, um, your whole physiology, your whole biochemistry. Biochemistry is based on breathing, really and truly. So if you get out of that acidic state and get more towards the pH, each tissue has its own preferred pH. The blood, has a very narrow range. The lungs, all the tissues have a very narrow range. So if you get back to more to that optimal pH, then you don't have to worry so much about decay or gum disease or gingivitis or even breaking teeth, because when you optimize your respiratory center and how you breathe, then you don't break teeth as much because you don't clench and grind. And so I'll do another video about clenching and grinding, but it's directly related to your breathing. I had sleep apnea most of my life, even as a kid, and clenching and grinding. And there's a whole sequelae of things that go with that. So back to the goal for our patients to be really healthy, you shouldn't need to come get your teeth cleaned twice a year. If your pH is optimal, your biochemistry is going to go optimal, your risk of decay is going to go basically to nothing. All your whole disease process goes basically to zero the longer you have optimal breathing, which makes optimal pH, which makes optimal biochemistry. So all of your hormone function, your immune function, your cell metabolism goes to optimal. Well, if those things go optimal, then that means you're going to decrease any autoimmune disease, any chronic inflammatory disease is going to go down and eventually go away when you get your breathing optimal, because that optimal pH means optimal biochemistry. So that's our goal for our patients, is to be really healthy and not need to get your teeth cleaned twice a year. So that starts with stopping the tartar buildup, which is osteoporosis. So I hope I have explained that in a way that is reasonable. The D3K2 is part of our prevention protocol with iodine. Every cell in your body needs D3. Every cell in your body needs iodine, and your teeth are those very needy teeth, very needy for those two things as part of our prevention protocol. We have a long list of other things depending on what problems you have, but basically, if your breathing is optimal, your pH is going to be optimal no matter what you eat or drink. It doesn't matter so much if your pH is optimal. You've seen some people that are just so fit and healthy, it doesn't matter what they eat or drink, and they're just really healthy. It's because their breathing is optimal. So that's our goal, because even if I never treat your teeth, if I can get you to have optimal breathing, you're going to be healthier, even if I can never get to you to treat your teeth. If you don't live here, or if I just, retire and don't fix teeth anymore, that's okay. I want people to be healthy, and you really shouldn't need to get your teeth cleaned twice a year. So that's my take on even as a former dental hygienist, that's my take on how healthy we want our patients to be.